let's talk about hypovolemia versus hypervolemia. Now, let's look at the meaning of each. Let's break apart the word. Hypo means low, vol means volume, and emia means in the blood. So this means we have low volume in the blood or the vessels. For hypervolemia, hyper means high, so we have a high amount of volume in the blood. Next, let's look at the signs and symptoms of each using a chart. The neck veins in hypovolemia will be flat. Again, there's not a lot of volume. Where in hypervolemia, we will have distended neck veins. You might hear this referred to as JVD or jugular vein distension. Okay, let's look at heart rate. They both are going to have an increased heart rate. But in hypovolemia, the pulse will be weak and thready. The heart is trying to compensate for this low volume and push fluid forward. But in hypervolemia, we are going to have a bounding pulse because there is a lot of fluid in the vessels. Let's think about this blood pressure. If you have less volume in the vessels, you're going to have less pressure on the arterial walls. So blood pressure will be decreased. As for hypervolemia, we are going to have an increased blood pressure. It works the same way. More volume equals more pressure.